So welcome everyone to today's Q&A session. My name is Mark Wilperger. I'm Business Management Specialist for the Lake Ontario Fruit Program at Cornell Cooperative Extension. So a Q&A session today is called Managing Field Crews During COVID-19. What actions should apple growers take? And it's a Q&A session. We have 4 panelists today, and we have a couple of other people from Lake Ontario Fruit to help us with this. We have Dr. David Bell from the Public Health Emergency Preparedness Coordinator for Genesee and Orleans County Health Departments, Dr. Richard Stupp from the Cornell Agricultural Workforce Development Council, Dr. Elizabeth Bin from the Institute for Food Safety at Cornell, and myself from the Lake Ontario Food Program. The objective today is to gain information for strategies and practices to reduce risk of COVID-19 occurrence and spread on your farm and to help contain the spread of COVID-19. The agenda today, I'm doing a little welcome right now. I'm introducing the panelists. I'm going to give a very short background on kind of the broader context of where we are in New York State with businesses reopening. And then David Bell is going to give a review of current guidance and general questions for from a local health department perspective. We hope to keep this fairly short, about 20 minutes total. Then we're going to take on some questions submitted ahead of time. And we're also going to take questions submitted during the session as time allows. If you could put your questions in the Q&A box, and Robert Batt, the Executive Director of CCC Orleans County, will moderate those, and we'll address those as time allows. And then I'll make some concluding remarks. I wanted to list these up front, sort of some basics today for resources. The Cornell Agricultural Workforce Development site has lots of resources and updates about all of these COVID-19 issues for agriculture. And Rich is the director of this program. The Institute for Food Safety at Cornell University has lots and lots of guidance on multiple pages, frequently asked question pages, a section for resources for produce and other resources, and it's constantly being updated by the food safety people at Cornell, and Betsy is in charge of that. On the New York State side, kind of the structure for going forward with the plan and putting good practices in on your site is the New York Forward site that is tracking and controlling the entire reopening of New York State. And for agricultural industry, guidance and other information is on the agricultural.ny.gov page, New York Ag and Markets. And there's plenty of other links within those to specific guidance, but I wanted to give just the big picture here of the main resources to head towards when you're looking for answers. So just quickly, a background about where we are in New York State right now with the New York Forward Plan. In early May, Governor Cuomo released the New York Forward Plan. There's actually a PDF guide that explains the whole process at forward.ny.gov. And the plan in broad terms is to reopen New York businesses by region with a phased approach according to metrics of how well each region is controlling the virus. There are 10 regions. In agriculture, of course, we fall across all these regions. So the phase at which our region is at really depends on where you're located. The idea of reopening regions is this balancing of how do you run your business while implementing the social distancing that has been very effective at reducing the infection rate of the virus in specific locations. This is just something off of the New York Forward site. This is the total positive through the duration of the virus. And you can see that, it really varies by region. And in Western New York, in the more rural areas, we have not had as much infection as the more populous regions and towards New York City. This was Sunday. This is off the New York governor's briefing that he gives every day. And by implementing all of these social distancing and other measures, we've been able to stop the rapid increase of infections, and it drops by June 7th on Sunday. The rate of people tested was 1.2% were positive. So this was, the lowest it's been since basically this thing started. And he also put up another thing here, which is showing the rest of the USA, which is we're kind of in a good situation in New York in that we have a very comprehensive plan for sort of scientifically and logically increasing the amount of business we're doing while we take steps to prevent the spread of the virus. And this is on a dashboard. And as of Monday, the final region, New York City, opened into phase 1, and all of the other regions are in phase 1 or phase 2 and about to go into phase 3. The New York Forward site has a business reopening safety plan template. Filling in the blanks in this template is a roadmap for making an effective farm plan for your farm. This is just a screenshot of the first page where you enter the name of your business, and it starts asking you about what specific things you're going to do to start doing more work functions, but take precautions against COVID. It breaks it down into people, places, and process. The first one is physical distancing under people, and that's on the first page. And really going through this plan is fairly straightforward. There's some check marks. You say, okay, I will agree to do each of these check marks. And then there are some questions. For example, the first box is list common situations that may not allow for 6 foot of distance between individuals. And so you might just think about your particular business and write in the places where it might be hard to maintain 6 feet of distancing. And then what measures will you implement to ensure the safety of your employees in such situations? The first one I listed was conducting tasks in the field, and I wrote down for my example farm, routine tasks will be redesigned so they can maintain 6 feet of distancing. They'll have their face covering with them at all times, and if there's ever a time when they cannot be maintained, the employees shall don their face covering. And then you just go through the rest of it like that. And it addresses all the aspects that you need to address. And then the idea is you can use guidance that has been issued from Ag and Markets. There were 3 pieces of guidance issued about a week ago. They are on the coronavirus page on Ag and Markets. Here are the specific links, but if you look for those particular topics at the bottom in boxes, at the very bottom of the page, guidance for prevention of and response to COVID-19 at farms, operator checklist for farms, and prevention tips for farm workers. So the idea is you read through that and use that as a guidance and recommendations of what good practices would be to implement these policies. I've gone on to the next one because screening and contact tracing are important parts of this. And the idea of this is that there's an army of contact tracers in New York State, in every region, so that not only are you trying to do prevention practices, you're also doing practices to identify if somebody might be sick and then to isolate them right away, and then helping the local health department with contact tracing by keeping a visitor log and other practices. And so those visitor logs and that screening becomes very important for trying to contain the virus from spreading throughout your farm and throughout the community. This is the idea of contact tracing. You test or you look for symptoms, then you trace everybody they had contact with in the past 48 hours. And then if it seems warranted, you ask those people to isolate. So I'm just going to repeat. Oh, and then, so the other important thing is that Rich Stupp and the Ag Workforce Development Council has developed a resource for developing a business safety plan. It's in the menu right in the top of the page at agworkforce.cals.cornell.edu that gives you examples of ways that you can address the different typical situations that you have on farms in order to meet what New York State is asking you to do for these prevention and tracing steps. So I'm just going to list these things again, although I'm not going to do it for very long because we're going to have David Bell speak now. David, you'll let me know when you want me to change slides, and take it away.
Perfect. Thank you very much, Mark. Hi, everyone. My name is David Bell. I'm the Public Health Emergency Preparedness Coordinator for Genesee and Orleans counties. That involves one health department between these two counties. What I want to do today is use my experience at the local health department level over the past few months in the course of this COVID-19 pandemic to answer some pressing questions specific to the interests of growers and field crews. Just to get us going, I've assembled a list of 8 questions I consider to be something of an FAQ or frequently asked question list. And hopefully it's a platform for all of us to kind of jump off of and respond to with our panel discussion. I've certainly not intentionally shied away from anything, so anything I consider somewhat tricky or difficult to answer, I've tried to include in that list. So we'll see how it all goes. Hopefully this way we can keep our session as informative and straightforward as possible. I have 2 quick disclaimers before we go on to the rest of those slides and those 8 questions. First of those disclaimers, there's a very fine line between state level directives and local interpretation and implementation of those directives. I think all of you with local businesses have seen this and felt that difficulty. It's a challenge we've seen a lot over the past few months. So I'm going to do the best I can to distinguish between my summary of state level guidance and my interpretation of how this guidance should best be implemented. So you're getting both a factual summary and an interpretation based on my own experience and perspective. If there's any confusion over where anything is coming from, we'll clear that up at the end. So my second disclaimer is that this is a quickly changing situation. If you are planning for crews in the fall, a lot might be different by then, hopefully for the better. In addition to the volatile situation we're in, there's a constant need for all of us to remain fluid and adapt based on whatever is a pressing need and our own capabilities. No one can really ask more than for all of us to do our best in the control of the pandemic, and ultimately that's what this is all about. So keeping that big picture in mind is really important. With that, we'll get started. Mark, if you don't mind advancing. I just want to also add that I'm a firm believer that half of knowing something is knowing the right questions to ask. So even though I want to go through all of these 8 questions, ultimately really want to get to any questions from participants today that have either been registered ahead of time or coming in as we move along. Rather than go through these now, I'd like to go through one by one and then get to the broader panel. So next slide, please. Even though I arranged these 8 questions in something of a sequence that made sense to me, we're going to start with the last one. So the quick presentations leading up to what I consider to be the role of the local health department within the pandemic response, especially as it involves farm interactions. There's a lot in the current state guidance that may suggest that local health departments are going to be very proactive and take a lead role. And I just want to clarify that lead role is really only in terms of guidance and consultation. Otherwise, we're much more supportive. We're very much in a supportive role when it comes to response and implementation of any planning mechanisms. So while we're trying to give guidance to develop plans, a lot of response will be on the part of local businesses and growers. And that's basically because we need to stay responsive at the county-wide level. There are times where we will become more proactive based on specific needs involving isolation and quarantine, but logistical support for those situations is really only a last resort. So these are all things we're going to be coming back to, and we're going to end on that as a final slide as well. So if we can keep going, we'll return to the basics. So this is the question number 1. If we go back just to the earlier one on the safety plan template. Mark already kind of ran through all this in a very effective manner. And I just want to keep that big picture in mind that we're doing this so that New York State can unpause and stay unpaused. And we're trying to comply with these different measures as a way to allow for safer return to business, where each of us kind of does our own part. So those guidelines are readily available. I want to add and emphasize that these plans do not get approved or even reviewed at either the state or local level. However, there is a specification that they should be available on premises for either state or local inspection. I'm not currently aware of any of those inspections happening at the moment, but I will add that if there's a problem, then it's likely to become much more of an issue. I will go on to number 2. So what's most important about these New York safety plans? From my perspective, most important part is doing them, having a plan. And the most important part of that is the intent behind it. So the intent that all of us are trying to keep in mind is building a safer and more responsible work environment given the current situation. The key components that you've already kind of quickly run through involve social distancing, appropriate limitation for occupancy or use, facial coverings and other appropriate personal protective equipment or PPE, hygiene, disinfection, clear signs to explain symptoms and other issues of concern, any requirements that people have to follow, health screening for different symptoms, information logging if there is a problem, that's important for the contact tracing, and finally, what to do should there be a positive COVID-19 in the workforce. That's the part of the planning aspect that I really want to emphasize being very important at the moment, and where I'm trying to give most of the attention, at least in this 10-minute summary today. Finally, the other really big important takeaway is that social distancing is meant to allow for otherwise normal function. I don't think any of us really want to be out in the field or at any job, any desk, wearing a facial mask all day long. It can be a bit stifling to say the least. And let's keep in mind that masks are when social distancing cannot be maintained. And our plans right now are to help support environments with social distancing, that 6-foot requirement, so on, so that our work can go on in a more functional way and function better as well as safely. Next slide, please.
David, there's a question in the Q&A. Is there a specific date that this plan needs to be in effect?
It's intended to be in effect for the reopening. So obviously, businesses that have been open as essential businesses, we're doing this kind of on the fly, but expected to do it as part of their opening. And as businesses come online and operations commence, it's intended to be part of that process. And since they're not being reviewed, they can be updated according to different functions. So yeah, these are important questions. And please interrupt because these are important and we want to get to them. So to go over the facial mask issue, because I know that's gotten a lot of attention and it's been a little bit difficult to address. So we know that therefore when social distancing cannot be maintained, but obviously there's different degrees of severity and interpretation of that. I will point out that when there's 2 scenarios that get a little bit increased scrutiny. That's when employees of a business are interacting with public or representing the business. It becomes a bit more important, and also engaging with public at within other facilities, whether it's shopping, laundry, and so on. It just gets heightened awareness. When we do not do our safety planning in a way that allows for the 6-foot social distancing, then becomes more important. So shared vehicles, workstations, recreational living spaces, wherever we can't maintain that social distance and we're not within a residential housing unit, that's expected to be using masks. However, these must be medically tolerated, and so it doesn't get enforced. It's one of those things that is socially supported and part of reopening safety plans. The only exception to that where it gets a little bit more tricky is involving quarantine. We'll get into the legal versus self-imposed quarantine in a minute. It's important because essential workers can keep working during quarantine as long as they're wearing masks, and that's general proximity of others. So again, a little bit more sensitive than the general rule. It's the employer's responsibility to provide these facial coverings free of cost to employees. So we'll keep going and come back to anything more specific. There's health and screening. that should be going on as part of these health and safety plans. And the two important part of that is a health assessment and then the risk assessment. So for health assessment, that's really looking at any known symptoms. Cold and flu symptoms is quite a few. And the important part of that is that they must be above what is personal baseline. So muscle aches, sore throat, congestion, cough and asthma, all of us can experience these on a regular basis, but when it happens above an expected baseline with concerns of it being part of a cold or flu communicable disease type illness, that's where it's really important. Taking fever is very helpful as an external measure. So fever is just one of the first go-to symptom. And the temperature we're looking at is anything in that triple digit, so 100.0 and above, for that to be marked. We'll get into what to do afterwards in a minute. In addition to that, a lot of the health screening should involve any known contact with COVID-19 positives or any recent positive tests. These should be fairly straightforward. They involve quarantine from the health department or isolation if it's a positive test, and it's the health department's role to inform workers and employers as relevant. International travel, that's a current guidance recommendation for self-quarantine, meaning it's not imposed from the health department, but is encouraged for international workers upon arrival. Next slide, please. So what sleeping or residential arrangements should be made? Current guidance is suggest housing in smallest groups possible, keeping beds a minimum of 6 feet apart, staggering use of any common areas, and increasing ventilation, cleaning, disinfecting of all these spaces. There's lots of questions right now about the use of bunk beds. The state safety plan guidance suggests whenever there's a confined space, it should be at 50% capacity. So that combined with the regulation 6 feet apart makes my understanding of using bunk beds to be very difficult and not ideal. So it's certainly not something that we want. If there's no other option, then it's expected to act responsibly and do the best you can. So the interpretation on the flip side of this is when social distancing cannot be maintained with capacity and 6 feet apart, that's where other barriers become a little bit more relevant. For those who can't wear masks, there's been scenarios of wearing kind of facial shields or creating barriers to make exceptions. But again, using some judgment and doing the best we can to, abide by the general principles is really key to this. So bunk beds do not seem ideal and would require more creative thinking based on those guidelines. Next slide, please. So what happens if there's a positive case? This is broken up into 2 slides and we're nearing the end. So first to address all those symptoms that have been monitored, what happens if someone says yes? So if it's clearly above baseline, the role of a supervisor is to be that in between to kind of validate that yes, this is above baseline concern, and not to act in the role of a medical professional. We have lots of medical professionals on the ready to assist it at this time, trained to do so. So whenever there's any question about those symptoms, supervisors and workers should seek medical advice and guidance, either from primary care physicians or established healthcare professionals. Urgent care is a last resort for that, to find out if that COVID-19 test is recommended. If the test is recommended from the medical perspective, work should not be resumed until a negative test is obtained and the worker is feeling better. If the test is not advised, the medical professional says, this does not meet our qualifications, then it's returned to work as normal when feeling better. If the test is taken and it's positive, that means the worker must be isolated, sleeping in separate quarters that can be closed off with separate bathroom facilities. Sick and isolated workers can only return to work after being released from isolation, and that's a minimum of 10 days. Requires resolution of symptoms, marked improvement in cough, and no fever within 3 days without any drugs, fever-reducing drugs. So there's these guidelines for when that can happen. Quarantine workers can work, isolated workers cannot. So to get to the quarantine, that's the next page. So
David,
again,
two questions. Sorry.
yep.
In the Q&A, how specifically do we reach a medical professional?
This is an important part of planning. So I know in our counties, we have certain providers that work with many of the growers and their crews. So having those providers, knowing which would be your provider and who to go to is an important thing to figure out right now. What physician, if there's no one else, then that is a question to go to urgent care. But that's obviously not ideal. So it's strong encouragement from health department and general healthcare perspective to establish those networks of healthcare providers. What physicians would be overseeing your workers? So that's a very good question.
Got a couple more that just popped up. Can
Yep.
you give clarification again on the specific difference between isolation and quarantine?
Thank you. So that's what I want to do right now. Isolation is for sick cases. Quarantine is for healthy people that have been exposed. Quarantine is for exposed with concerns that they may develop the illness. So quarantine requires same type of separation from non-quarantine people and requires monitoring of symptoms to see if the illness will develop. Just to run through the slide very kind of quickly, the quarantine workers can keep working, but with masks, requires separate facilities, and it's 14 days of monitoring and temperature and symptoms, as we already kind of went through. Should those symptoms develop and be COVID-19, then that's going to be turned into a case of isolation. I also want to point out that if quarantine workers are being housed with sick workers who are isolated, then that quarantine continues until the end of that exposure period. So the end of that person being isolated begins the next person's exposure. And these are legally enforced restrictions by the health department. Law enforcement get involved. It's different from self-quarantine you sometimes hear in the news, such as the requirement of after international travel. That's expected to be a self-quarantine, as opposed to when it involves active cases and close contact with active cases, that gets followed up, and those monitoring of symptoms and temperatures actually get reported to the health department, and this is when we get a bit more involved. So workers under either isolation quarantine, they can be grouped together. This makes sense for quarantine, but it does not make sense for isolation. If someone is sick but does not need to be hospitalized, we really want to get them out of that environment wherever they are to be alone. One, so they're not infecting other people. And even from the pragmatic point of view, that the quarantine of all the rest of the workers will last until that person is removed. So aside from public health concern, there's that practical element.
Another question related to quarantine. Do we need to quarantine H-2A workers when they arrive from Mexico? How do you isolate and use separate bathroom in a labor camp that houses all workers?
So another good question. If they're coming from international places, they're not being isolated unless they're sick. So they're ideally not traveling if they're sick. So they'd be quarantined, and this would be a self-quarantine. It's a recommendation after traveling to be under self-quarantine. That means not doing additional travel, so restricting travel and being more proactive with mask wearing. Other than that, it's relatively normal activities. Work is allowed and so on. Under that self-quarantine after travel. But it's monitoring for symptoms regularly, which hopefully is happening for all regular employees anyway. So they can be housed together. We're just being very ideally trying to keep those under that self-quarantine separate from those who are not under that status. And it's a question of kind of staggering the housing units, using the smallest units possible, and being kind of proactive and being as careful as possible. So again, this isn't being monitored in terms of who's doing the self-quarantine, but if there's a problem, it will certainly get a lot more attention and scrutiny, and should be part of the current safety plans. So it does require some proactive thinking. We got just one more, and then we'll kind of open up to the whole panel, and we'll come back to some of these. So what do I have to do to support isolation of positive crew members or the quarantine of exposed crew members? So obviously farms should work with local health departments and available guidance to develop these plans. As far as I know, all of my counterparts and local health departments are very happy and eager to share information and help in the development of plans. Enacting the plans becomes a little bit more difficult and responsibility of individual businesses and their farms. So workers under official isolation and quarantine must still be paid. So that's a very important consideration. That's different than the self-quarantine that we mentioned earlier. So when there's kind of that legal aspect, there should still be pay and they should be reimbursable. So we'll leave those questions until the end. Further assistance, logistical support that may be arranged through local health departments. We certainly help as we can and where we can, whether it's coordinating volunteer services or other forms of delivery, but for the most part, that's seen as a responsibility of the local businesses to attend to that. Attending to the logistics of food and shelter of isolated or quarantined individuals, that only becomes the responsibility of health departments as a final resort. At that point, there'd be more scrutiny of the safety plans and anything else. Basically, if there's an option for the health department to make a move or a rearrangement, the health department would do that. Otherwise, an entire housing unit could be quarantined, which would simply mean less movement and restriction, which wouldn't be too invasive. Or an entire unit could be under isolation, which would mean that entire unit would not be eligible for work and could spread within whoever's there. So that's less than ideal. And that's summarized in the final slide. If we go back to that just to end on. This is where we started. What assistance or guidance should I expect? So that last resort of isolation quarantine likely occur for a whole unit under quarantine. Certainly not what we want for isolation. So right now, this is what we want to encourage the most, is to think of how you could isolate a COVID positive patient, either on your own premises or through collaboration and agreements with other farms or other growers to designate one facility should anyone within a set agreement develop the need to use it. So thinking about that now is certainly the purpose of planning. Happy to address any further questions related to this or anything else that's kind of come up. And I certainly want to open up more to my colleagues that can kind of supplement and add to this as well. Thank you.
I think it would be good to take any questions based on David's talk that have come up on the floor right now, Robert.
Sure, so there's several in the chat. One question, David, is that a document typo? I've seen one state document that states the temperature should be 100.4 and most recently 100.
Yeah, thank you. We've seen a bunch of that too, and it just kind of slowly started happening where, the initial state documents were often citing 100.4 and more recently 100.0. The most recent guidance that's come out specific to growers and work crews explicitly does state 100.0. So if you are in that context of monitoring field crews and a grower business, then it's the 100.4 you want to 100.0 you want to pay attention to.
This is Betsy. I do want to note that 100.4 came from CDC guidance that was published initially when people were coming back into the country. So there is a document, a guidance document, I know at least one from CDC that does recommend that 100.4. So that's why you're seeing, I guess, a couple of different numbers. But so if you have seen the 104, that is out in CDC documents.
Another question relevant to temperature: what is the best procedure and device to use to monitor body temperature of workers?
Another very kind of good question where there's a lot of kind of recommendations, and the main recommendation is to monitor for temperature and fever, whether it's feeling feverish or anything else. The most ideal scenario is using the contactless thermometers. They're very easy to use. They're about $60. And when you think about the practical implications, that seems very well worth it. I know a lot of businesses that are just requiring people to monitor temperature at home. And if they forget, then there's, an oral thermometer at workplace with the little plastic covers for it. But for any business such as a grower with a set field crew, having a contactless thermometer that you kind of hold up to the forehead and very quickly get a reading seems like a very good investment and it's kind of a smart, reasonable thing to do. But again, your only obligation is to assess for symptoms to the best of your ability. But any farm that can afford the $60 contactless thermometer, I certainly encourage it.
David, this is Richard. I'd like to break in a little bit on record keeping and documentation around that screening. We're recommending that people not write this information down about all employees as they're screening them, that they simply screen and write nothing down for people that pass the screen. But when they have a elevated temperature or they have something like that, we simply indicate that they didn't pass the screen, and then follow the additional steps that that the health department recommends for dealing with that situation. Do you have any additional guidance on records to write down and some of the implications of writing that information down?
That's correct, and I agree completely. We do not want to actually write down personal temperatures. There's kind of more need to keep privacy and everything related to that. So businesses that are keeping logs of that, I've seen lots of checklists where you just check that you do not have symptoms and your temperature is under the 100.0. And there's really no need to do anything more than that simple check that, yes, I've looked for my temperature for that day, that work shift, and I am otherwise symptom-free above baseline. So that's an important point, and thank you for that clarification.
Related question, are you familiar with any of the screening apps that are now available? Are there any that are freely available that would be suitable for a small business?
There's lots of this stuff out there. We're getting flooded with it, but from my perspective, the simplest is, do you have any cold or flu symptoms, fever, cough, sore throat, fatigue? The kind of list of symptoms is kind of right there. So if it's useful having an app as a reminder, you can do that. We've seen it like for that temperature logging and checking off as a temperature. But I don't have any set recommendations related to that or individual products to support.
Okay, there's 3 more into the Q&A, and then we move into the pre-submitted. Why can't a farm worker keep working during quarantine and isolation like a white-collar worker? Their own vehicle and bathroom, report on phone to supervisor, and goes directly to field. Otherwise, an asymptomatic worker has a prison sentence.
So good point, and I just wanted to kind of clarify that quarantine means not sick, but exposed, so they may develop the sickness. It's important for us to monitor exposed people because you're most contagious in the 2 days, the 48 hours before you develop symptoms. So that's why we do the contact tracing and everything else. That being said, any individual under quarantine, any type of work, any type of essential work allows quarantine work to continue. So all farm workers that are quarantined can continue work. Those who are isolated because they are COVID-19 confirmed positive. And we do not want to have them intermingling with others. And they're also likely to be sick. But it is a fair point that many positives are asymptomatic. So if you are not having any symptoms, but you are positive from PCR analysis, so if you are positive for the virus, then you will still be isolated even if you don't appear sick and you're not able to work. So in many scenarios, if there's one person that has been identified to be positive, there'll probably be all close contacts will be tested. Anyone else that tests positive, even if they don't appear sick, will then be under isolation and not able to work for a minimum of 10 days. So that's why all this really matters, and being preventive is really important. Quarantine allows essential work, isolation, no.
And multiple positive, oh, sorry.
I had heard that question before. I think the question is perhaps relating to the fact that if somebody's positive and they're a office worker, they could continue to work from home. And there might be certain farm situations where someone could go out and work by themselves in the field and drive themselves from their own house and not expose anybody on the job. And I think that's what the question was getting at.
I understand. So yeah, it does get more complicated with modern technology. And if isolation as it's defined by the health department can be met while still working, is that possibility. That being said, there should still be state support for compensation for those workers for up to 14 days. So most people asymptomatic that I've known have still been kind of taking that time as white collar workers rather than working. But that would be kind of discretion of individuals and employers and so on. So at the very core of it, could someone keep working only within the context of isolation, being out in the field kind of goes beyond what's expected of being within a contained, isolated unit. So it is different simply based on that status. Unless it can be done remotely through internet and other technologies. But just the general social distancing is not enough at the time of isolation.
I'm going to go to a couple of the pre-submitted questions. Question for Betsy. Do I need to provide face masks for my customers and visitors?
You don't need to provide masks for your customers and visitors. They should be coming with masks to your operation. What I will say is that if you have a box of masks that are there, like surgical masks, that you can give people if they forget to bring them, then I think that's good. The example I give is the other day I got out of my vehicle to go somewhere and I had my mask on and another gentleman was getting out of his vehicle and he looked at me and he was like, oh no, I forgot my mask, right? So if you have masks there, that gives people the option of doing the right thing, but you don't have to supply them. I think the other thing is some places are selling them. So that's another option, you know, you could do, but you're not required to supply them.
Question for Rich. Where do I submit my business safety plan?
Good question. We hear this a lot. You don't submit your business safety plan. You do need to have a copy of it available on the premises. And as David said earlier, at any time, the state or local authorities could ask to review that. And certainly, if a problem happens, if you do have a positive incidence of a worker at your place of business being infected, and the local health department is involved, they're certainly going to ask for your plan right away. So no sending your homework into the state. You don't have to submit it, but you have to have it done.
Question from the Q&A for anyone. Do you have to have markings in your store at the register keeping customers 6 feet apart?
I'll jump in. The quick answer to that is no. You just need some plan in place to help ensure the 6 foot social distancing. So that's what a lot of businesses and companies have done, just as a a quick measure to help support that. But it's really on you to come up with what you think will help support social distancing enough to kind of stay open. So it's a good idea, but not enforced, no.
Yeah, and if I can add to this, the one thing that is just critical during this time is communication. People are more likely to do what you want them to do if they know what you want them to do. So signage, marking, things, people aren't good at judging 6 feet. I know I'm not, but so, how to keep that distance. When I go into businesses where it's marked, people follow those markings. They stand on those dots. They stand on those lines. But if they're not there, then they're left to sort of guess what 6 feet is. And that can work both ways, right? 6 feet can turn into 12 feet. So then you're using up more space. But I would say anything you can do to communicate, signage, tape, rope, those are all very helpful to the customers.
Questions related to screening workers, and I'm going to combine them. Can an employer require that prospective employees get tested for COVID before being offered employment, or do HIPAA privacy protections prevent growers from requesting results? And can you comment on the idea of testing the whole crew when they arrive from Mexico in the fall?
I'm going to kick the legal aspect off to Rich or someone, but I will say in terms of the current prioritization scheme for the local health departments, as we are testing people, we're required to use the kits in a prioritized way according to community need. So right now we're still basically testing only people who are symptomatic or close contact of symptoms. So as test kits get more readily available, as it's easier to do this, it may be possible to test entire crews upon arrival. For right now, that would kind of be an own personal initiative and wouldn't be done at the county level. just based on that prioritization scheme.
Yes,
Rich, do you have
and
thoughts about the legal implication?
yes. So from the legal standpoint of during the hiring process of testing someone for COVID-19. So COVID-19 is a global pandemic. And when that happened, it became a direct threat to the workforce. That's the terminology that the EEOC, Equal Employment Opportunity Commission, would use for this. So that changed the rules. That's why you can do the temperature checks. That wouldn't be allowed as a medical exam in normal circumstances, but with COVID-19 it is allowed. And please, everyone understand, when this pandemic is over, all that goes back to the way it was before. You won't be able to do temperature checks, not that you want to. But similarly, once an offer is extended to an employee, then you can do medical checks, including for COVID-19. So now you wouldn't, what you're doing at that point is preventing that direct threat to your workplace. So it's not a matter that you wouldn't extend them an offer, but you could delay the offer then until they've gone through the quarantine or isolation period, whatever is required. However, if the job had to be done immediately, if it's harvest time and the apples have to be picked, then it is grounds for not extending employment offer to that person.
Can multiple positive workers be housed together? How and where can we achieve isolation in a camp that is fully occupied?
The first part of that question is yes, multiple isolated workers or positives can be together. So that would be an isolated unit. So they do not have to be separated from each other if they all are positive for the virus and isolated. But non-isolated workers, people who do not have confirmed virus, could not be part of that. So identifying a unit that could be used simply for isolation purposes is really important. If there's not one available within your residential setup, finding a way to share with other businesses, farms, or other circumstance would be the next recommendation that would come to mind. Only when no alternative arrangements can be made will health departments kind of jump in and look for something different. We have contracts at different hotels generally to allow us to isolate when there's no other option. But not ideal, especially if there ends up being multiple people involved.
Can I pitch in on that one as well? So Cooperative Extension and Farm Bureau have been doing a project across the state, and David's actually helped us out with that. But to just assess where the county health departments in the major ag counties across the state, where they are in terms of understanding the agricultural workforce and planning for that. And we found that there is great variation across the state. David and his counties are well prepared. There's other counties that have, all the county health departments are extremely busy. And some just have a better communication and understanding of their ag industry and the workforce that's involved there. So my message to all the producers, and I know we're reaching people across the state, is to be very active with, reach out to Extension, reach out to Farm Bureau and your other grower organizations, but be communicating proactively with your local health departments about this. And I encourage you to be banding together and trying to find additional housing in any way that you can. Because as David said, the county health department is going to be available to support you, but they're not necessarily going to go out and find housing in advance for you. So build a partnership, open up those communications, and start working on this before we get to that crunch in the fall where we've got our maximum population of workers here in the state.
That's all very correct. In general, we're very happy to take that kind of coordination role and collaborative role. I know in my counties that we've had a few farms that have said, I don't want to broadcast. I'm certainly not going to identify people on the webinar, but yes, we have a facility, and if other, similar businesses really need help, we're willing to help. So you, as other growers, may not know that. So If you're in need and you can't identify something else, reaching out to the local health department and kind of explaining that and looking for support is certainly reasonable. We just prefer that to happen before there's a problem in a situation. And as I mentioned before, if it becomes unreasonable to move people out of a housing unit, such as to a hotel situation, it is possible for an entire residential housing unit to be put under isolation. I know counties that have done that in other parallel type situations, and that means anyone housed in that unit cannot work for 10 days at minimum, and it gets a bit more complicated.
Robert, can I
Yep.
add to 2 questions ago that David and Betsy addressed about communication with visitors and customers? I think communicating with your employees, especially if you have H2A or other worker, farm housing workers, this communication might be one of the most important things you do for them to try to address this. So not having posters up and that sort of thing, but regular updates about what's going on and reminders about how to socially distance, all of the basics, especially in their off time, that they should know when they go into town. In New York State, you're required to wear a mask when you go into a store. All of these sort of things, it's probably impossible to over communicate with your employees and your workers.
Yeah, I would like to add, this is Betsy, I would like to add, it's new for everybody to be communicating with workers about risks outside of work, right? Normally we're used to talking about work-related issues, but this COVID thing requires us to talk about how do you protect yourself at home? How do you protect yourself during transportation? How do you protect yourself in public? And I think that's new, so I think we all have to recognize that. We did make a poster or a fact sheet about this to try and help, that is available at the IFS website, and I'll put the link in the chat box. But I think it's a really good point that you can't over communicate on this. And I think the other thing that's important is there's a lot of misinformation out. So understanding the misinformation that's out there and being sure to provide science-based information to your workers so that everybody has the best information possible.
I have 2 questions related to handling product. How do I need to handle the fruit and equipment? And also, if a harvester tests positive, is the fruit they harvested considered contaminated?
So I'll start with this. First of all, just a reminder, COVID is a respiratory virus transmitted person to person through respiratory droplets. So it's not a foodborne pathogen. So that's the first part. Handling fruit is the same as we've always handled fruit. You don't need to do anything different on handling your fruit. I think the thing that maybe is a little different is make sure people have access to hand washing, make sure people have, access to stuff. People have asked, do they have to wear gloves while they're harvesting? No. Good hand washing is good enough. If you want to have a hand sanitizer on top of that, that's great. In terms of equipment sanitation, cleaning surfaces that are touched often. So, tables where people are eating, if they're cleanable and not like outside wooden picnic tables or something. Door handles, maybe looking at your cleaning and sanitation schedule and adding those pieces to it. And no, if a person shows up positive, you don't need to go back and discard all that food.
Question regarding isolation. Is the determination that a person needs to go into isolation made by DOH?
Yes, so we get notified that the test is positive, and then we reach out from our staff to give that news, and at the same time give formal isolation orders, which are legally enforceable. And then through contact tracing, close contacts, meaning people that have been within 6 feet, less than 6 feet, without wearing masks for any length of time, generally 10 minutes or more, those are considered the close contacts that will have official quarantine orders as well. And just to tack on to the last question, we fully are on the 100% same page from the health department perspective. this is a respiratory illness, and it's respiratory droplets that are primarily cause of contagion. So the reason why masks and other forms of shields work is that they're a barrier of the respiratory droplets spreading from person to person, generally either being inhaled or through eye membranes and so on. So either the 6 feet or the barriers will allow immediate break of those projected respiratory droplets. And that's the main cause of spread, as opposed to touch surfaces and everything else. Of course, we want to keep our disinfection and sanitation in mind. But
This question is in the Q&A and was submitted ahead of time. How will you disseminate information to Spanish-speaking employees and managing Spanish-speaking crews before harvest time? Do you have written materials in the Spanish language?
There are an abundance of educational materials in Spanish. IFS has a bunch of videos, fact sheets. The fact sheet I just put into the chat box is currently being translated, so that'll be available. There's stuff on CDC's website, FDA's website. There is an abundance of material in Spanish. If your workforce can't read, there's videos, there's lots of options in Spanish. And I would encourage, if you don't have somebody on your staff that is bilingual or can speak Spanish, that's going to be something that's going to be a priority in terms of communicating with your workforce if you have a Spanish-speaking workforce.
Question that was submitted for Rich: is the due diligence of having a comprehensive COVID-19 plan meant to be a primary deterrent for frivolous lawsuits?
Yeah, I'll take that one. So I think the due diligence from the state's perspective of having the business safety plans in place is really just to ensure compliance, to make sure that more businesses, that all businesses, frankly, across the state and organizations have a plan in place and are doing the very best they can to put those good safety practices that we've been talking about into place. All that being said, we're trying to get the word out from Extension that businesses, our farm clients, need to be thinking about liability that may come out of this whole pandemic. And there have been news reports, and the different legal organizations are writing articles about there will likely be lawsuits both during and after the pandemic. There are already some high-profile lawsuits with big companies like Walmart and Tyson, where actually it was the families of deceased employees who were accusing the companies of negligence. So we don't want to be in that position with our farm businesses. So we want to do everything we possibly can, write these safety plans down, train, manage, follow up, and be sure that all these safety practices are actually happening. And furthermore, document that they're happening as much as possible. That's checklists and checking off forms and things like that. But make sure that you're managing it to make sure it happens, because we don't want to protect our businesses from liability. Imagine the situation down the road if something happens, very unfortunately, an employee dies or is sick or injured from COVID-19, and there's a lawsuit later on. Certainly there's the cost of the lawsuit. There's, the potential of even losing that lawsuit, although there should be some good protections for employers through things like workers' compensation, which provides some protection. So keep good records of what you're doing, what actions you have. Begin with this written safety plan, and then follow up with some additional written records of how you're following through and monitoring things. And I keep saying written because written documentation is much more powerful down the road in court than just verbal he said, she said, and weak recollections of what happened.
Rich, would you like to tell people about the upcoming webinars for filling out the making a business safety plan?
Thanks, Mark. Yeah, so we've had a team from Cornell working on resources to help farms and agribusinesses deal with the writing of the farm business safety plans. I understand this is a tough time of the year for farms to get this done, but it is a critical priority for all these reasons we just talked about. So what we did was we pulled together resources, organizing a bunch of the Cornell resources that were available, also organizing the state resources and providing some documents that have some suggestions for how to complete those documents and links to all the appropriate resources that will help you out. That's available on a website on the agworkforce.cals.cornell.edu website. And I also put that in the chat box. There will be some webinars coming up that get very specific. So there's actually a fruit and vegetable webinar on that topic coming up this Thursday. And it is at 12 to 1 this Thursday. So you should see that coming out in a lot of different communications, but you can also go to the Ag Workforce website to get more information.
Yeah, this is Craig from the Fruit team. We're going to send out an email blast to our enrollees with that information this afternoon.
There's about 4 more questions left that have been touched on, but they're worth revisiting. Is it okay that if a crew arrives in the same vehicle, that they worked closely together during the workday? And if we can socially distance the crew, do they need to wear masks while in the field or orchard?
So, go ahead, Betsy.
Yeah, I'll take this one for the first one, and I'm interested on David's thought on this as well. So if workers are literally living in the same house and transporting themselves together, it's what we call a cohort, right? So if the cohort is already sort of exposed together, if they're working together, your risks are not changing because they're together at home, they're together in the car, and they're together at work. Ideally, in an operation, you would keep these cohorts together. So you don't have cohorts intermingling 2 or 3 people, because then your cohorts now have exposed to each other and you have one bigger cohort. And the risks increase the bigger the cohort, right? So if your workforce is all together and somebody gets sick, then they're all at risk and have to go through the quarantine that David talked about. So when you think about it, and each operation's different, having those cohorts work together is fine, because then the risk is limited to that particular cohort. So I don't know, David, if you want to add to that or not.
Yeah, I agree with that completely. So the cohort perspective is really important in terms of that potential for contact tracing. It certainly is complying with breaking up into the smallest unit possible for residential and other arrangements. So if it's really in the context of being a cohort, part of a deliberate plan, I certainly understand and I agree with that. I will say that on the other side, wherever you get out of that vehicle, people may not know how careful you're being with that cohort. They may assume that it's just random people swapping in and out of the van at different times. And there's a lot of speculation at the moment. So I think that's really important to keep in mind how things look from the outside as well, as business owners, as anyone trying to support the general social distancing efforts. So that was my only kind of addendum, but otherwise I totally agree. And if social distancing is happening, then no, you do not need to wear masks. So the whole purpose of designing social distancing and separation is not have to wear masks. My other hesitancy with the car is that there is state guidance. It does say when there's shared vehicles to use masks. So people will certainly be looking for that as a result of that state guidance. But in terms of the public health implication, I agree with Betsy 100% on that.
Question on a lot of documents.
I think to add to that question, I received that question. I think this may also be being asked about a situation where they're not a group of people who live together, they're employees who come to work. And I think the question was more like, if they're in a vehicle together, then does it matter when they go outside and work to socially distance? And I think it may have overlooked the idea that there's kind of a really basic thing, I think, for all of these situations most of the time, which is if you can socially distance, you socially distance. If you can't stay 6 feet apart, then everyone should wear a face covering. And so the guidance from the state says if there's more than one occupant in a vehicle, everyone should wear a face covering. So in that situation, those people would then go to the field. If they're more than 6 feet apart, they can take off their face covering, but if they have to work more closely together, then they would put on a face covering.
And again, I think that is true. I think the other part that needs to be taken into account here is time. So exposure to people is not only this distance thing, but it's also a period of time. So if you're traveling in a car and you're only going a short distance, you can get the windows down, you can increase airflow, you know, you're going to reduce risks that way. And again, if they're not a cohort, and thanks for pointing that out, Mark, because I was thinking of it more from a cohort perspective. If they're not living together and they're not the same group, but they have to transport themselves in the same vehicle, staying as far away from each other in the vehicle, you know, not sitting side by side. If you can sit in the back seat away, wearing face coverings is important, and limiting the amount of people in the car is also helpful for risk reduction.
And all that being said, if there is the development of a positive case within 2 days of that incident, there will be questions as to why people weren't wearing masks within the car. So just to throw that out there.
Question related to document guidance. When it refers to family reunits, should the cohort serve the same purpose?
Yes, we talk about it as a residential unit too. So whoever's kind of residing in close contact together.
And again, I just want to remind everybody, the purpose of wearing a mask is to protect others from you, right? The mask is not protecting you from inhaling things. It's protecting your droplets from being spread to other people. So just to make that clear, because there's some surveys out there that that's not clear to some people.
Question for Mark. Is CCE LOF, like with GAPS, going to have a mock plan or inspection?
No, we will not be having a mock plan or inspection. I think our guidance, we're working, while CCE, Rich is doing efforts, there's been a lot of efforts from Cornell to write best practices for different things like UPIC and other enterprises. And since this is not something that gets submitted or has a formal regulated inspection like other things like Food Safety Act, this is not something we'll be doing actual plans, but we're happy to help with people prepare their plans. So if they have a question about something, they can call us up, and then we can call David or the right person to get the correct answer.
2 questions left in the Q&A. Rich, what about people losing their jobs due to getting COVID?
Yeah, I'm not quite sure what the question is about there, but just a couple of observations about it. So there are benefits available. The unemployment benefits have been extended for a longer period of time, and also there was federal government put an additional $600 per month on top of that. So if someone should lose their job, unemployment should be available to help cover that. But short of that, employers that are continuing to operate should not be firing people based on their getting sick with COVID-19. That would definitely be an employment violation. But if a business should close or has to downsize dramatically, then in fact people could be losing their jobs, and unemployment would kick in at that point.
Somebody shared in the Q&A that there's a myth or report going around in the ag worker community that I believe it refers to inspections could happen, and it needs to be communicated that this might not be true. Does anyone want to speak to that?
Inspection sounds like health department type word. Hopefully people realizing this, it's more than what health departments do. So I'm not sure. There are kind of regular inspections that are done from the sanitarian side perspective. They continue as normal. In terms of anything that would be above and beyond that, in regards to the health safety plans, as we mentioned right in the beginning, those need to be made and available should there be any inspection from either local or state level. As I mentioned in the beginning, I'm not aware of those happening, and certainly not in any routine basis. I'm not sure how we could manage that. But if there is a problem, then it'll certainly come into question, and people will be looking at what that plan was specifying.
And what I think is
that myth question, Robert, that might be referring to people losing their jobs as well. So just to address that briefly, again, employers should not be firing employees just based on their COVID-19 status. There certainly is sick pay benefits available from the federal government for up to 80 hours of work that can be covered, and that can be reimbursed. Then that sick time can be reimbursed to the employer. So, you know, if the myth is going around among employees that they can be fired for getting COVID-19, you need to communicate and stamp that out as quickly as possible, because that's going to cause people to hide symptoms. So please do communicate about that and correct that situation.
And it looks like one final question. If a retail location does not allow for customers to be 6 foot away due to permanent displays, is it okay if everyone is wearing masks?
That's the purpose of masks. If we can't maintain 6 feet, then to wear masks. And again, it's to help prevent spread, protect others from us. So most spread is from people who don't even know they're sick, contagion. So to stop our own respiratory droplets, even if we do not know we're sick, when we cannot maintain 6 feet.
And I would also say that in general, the maintaining 6 feet gets kind of weird when you're talking about customers in a sales environment or in a location, because you're constantly moving around and walking by people. So you're going from 6 feet to not 6 feet, 6 feet to not 6 feet. So I just think, you know, as the recommendation stands, wearing a cloth face covering is really, really important when you are out and about in public. It's one thing if you're walking in a park by yourself that you have no chance of bumping into people. But as soon as you get into these retail environments, just keep a mask on. And most importantly, nose and mouth. I do want to stress that. For some reason, people love to wear them under their nose. And there's a lot of really funny memes about why that's not appropriate. But the point is really nose and mouth, and wearing them very consistently in public is helpful to everybody. And it really is not about being a wimp, not about fearing for your life. You're actually protecting others. So it's really a good thing you can do for your neighbors and your community members.
Do we have more questions, Robert?
I think that it's about the end of the question list. I was asked in the chat to remind everyone that if you need sanitizer or face masks, that your local CCE should have a supply available.
So at this point, I'd like to ask each of the panelists if there's any information they want to give out about upcoming things or how to contact them or anything like that. I guess we can start with David.
Just continuing communication is great. Thank you for everyone for paying attention and any participation, and happy to get any other questions kind of online or offline. So anyway, I've enjoyed this and hopefully we'll be in touch.
Rich?
Yeah, just get those business safety plans written and join the webinar and access those resources that we talked about at the Ag Workforce website.
Betsy?
Yeah, we are having produce specific office hours June 18th at 7 p.m. Eastern time. We've been trying to move them around during the day so people have access. We're also working on a webinar that will be after that for community-facing businesses to help address the problems we sometimes have with people coming into our businesses. Those will all be advertised and hosted by IFS at CU.
Robert, do you have anything?
Just thank you to everyone for sharing today. I feel like this was a wonderful conversation, and there's going to be many of them in the future.
All right, I'll just mention that we have been recording this and we hope to post it up soon. And I want to thank all of our panelists very much. And I hope we can continue, you know, sort of this moving target of figuring out what everybody needs to do for their businesses and their employees going forward. And Cornell and Cornell Extension is available for questions. It's really a primary purpose of us right now to help farms during this crisis. So thank you, everybody. And with that, I think we'll end this session. Thank you all for